My name is Tracy Gordon, and this is my video demonstration on the effects of secondhand smoking on children. Secondhand smoking is classified as the involuntary or passive inhalation of tobacco smoke into the lungs of someone who is not smoking. Secondhand smoking can be easily identified by its distinctive odor in hair, clothing, and furniture. Secondhand smoking is unpleasant to many people. It irritates the eyes, and most importantly, tobacco contains over 4,000 hazardous chemicals, of which 43% of those causes cancer. Approximately 46% of people within the United States smoke. Of those, 50 to 70% of those smokers have children. There are, of course, many detrimental effects of secondhand smoking. These mainly affect children of the age of 0 to 5 years old. Secondhand smoking has been linked to children's lungs and respiratory tract infection. Secondhand smoking has also been linked to asthma in children. Secondhand smoking can be chronic and is linked to a variety of respiratory tract infection. In fact, a 1992 study by the Environmental Protection Agency, also known as EPA, announces that secondhand smoking causes between 150,000 to 300,000 respiratory tract infection each year of children between the ages of 18 months old and 5. These illnesses results in an average of 15,000 hospitalization visits each year of young children. The risks are also doubled for parents who smoke at least one pack of cigarettes. Secondhand smoking has also been linked to ear infections, and it also affects a child's brain. Ear infection and middle ear infection are the most common causes of secondhand smoking in children. When these illnesses are not treatable by a doctor, at this point surgery or medical treatment is needed for children. A tube is then placed in a child's ear to prevent further. So, who exactly is at risk for secondhand smoking? Secondhand smoking is dangerous to everyone. Fetuses, infants, and young children are most at risk for dangers of secondhand smoking. Secondhand smoking has been linked to a variety of lung, brain, ear, and respiratory tract infections. Did you know that 3,000 to 5,000 non-smokers die each year of lung cancer? While these facts are alarming to everyone, you can stop your child's exposure to secondhand smoking by following these simple preventative methods can help you and your child avoid secondhand smoking. If you smoke, stop now. You can consult a physician or your doctor for help. There are many pharmaceutical products out there that can help you quit smoking. If someone in your household does smoke, it is advisable to inform them not to smoke around your children. Advisable not to smoke in a car with your children. I do recommend as well to take your children to a school or public facility that is smoke-free. Now, please direct your attention to the screen behind me. I would like to show you a graphic image of a child's lung that has been exposed to the dangerous effects of secondhand. According to the Department of Health and Human Services, the health consequences of involuntary exposure to tobacco smoking is hazardous to the health of young children. Tobacco smoke causes a variety of these symptoms if inhaled by children. Tobacco smoking can cause brain tumors, middle ear disease, lymphoma, respiratory symptoms such as impaired lung function, asthma, sudden infant death syndrome, leukemia, and lower respiratory illnesses. According to the American Medical Association, also known as AMA, children has been linked to a variety of severe causes due to secondhand smoking. 24,300 to 71,900 low birth weight or preterm delivery has been reported. 150,000 to 200,000 respiratory infections annually in infants and children under 18 months has been reported. 200,000 asthma episodes has been recorded annually as well for children whom has inhaled secondhand tobacco smoke. Thank you. This has been my demonstration speech on the effects of secondhand smoking.